Hello, I'm going to talk today about a very interesting topic regarding our health. It's colon cancer. Colon cancer is one of the common disease we've seen these days and is affecting a lot of people's old age and young age and middle age. So colon cancer usually affects the colon, which is about 1.5 meters in the body. It's the distal part of our gut. The patient usually present with maybe abdominal pain, maybe is loss of appetite, maybe is not going to the bathroom in the normal way, or sometimes they have bleeding when they go to the bathroom. So when the patient has these kind of symptoms, or the patient may be asymptomatic, maybe he has only the symptoms of losing blood, which is what we call it anemia. They will have tiredness, unable to walk properly, and he feels that all the time want to sleep, or he has these kind of symptoms which maybe the cause is something in the bowel or the colon which causing this problem that leading to anemia. So when the patient comes to these kind of symptoms, has to go to his doctor and has to do some investigation. What investigation we usually do if we suspect cancer? We usually do that. First of all, we have to do blood workup, which is called the CBC, the blood count, to make sure the hemoglobin level is normal. And we do a liver function test, which is the function of the liver, to see if the function of the liver is not abnormal, and coagulation profile, which is the clotting. Then we'll go ahead to proceed with colonoscopy. If you suspect cancer, we'll go ahead with colonoscopy. Colonoscopy is a procedure we do with a day procedure. The patient has to take some bowel prep, which is prep the colon to do the colonoscopy. The colonoscopy, it takes about 20 minutes and is very safe. So we do it all the time, every day. The colonoscopy is the main diagnostic procedure for colon cancer, and it will show us if there is any colon mass or cancer, and we can take a biopsy, and this will help us to diagnose the patient with cancer. Then, if we diagnose the patient with cancer, the cancer location is very important. It's very important that it's located in the colon itself. Which part of the colon? Because we have the colon's 4 parts: ascending, the transverse, descending, and the sigmoid. And then we have the rectum, the distal part. Each part treated differently. So if we have a colon cancer in the right side, is surgical treated, and the transverse side, transverse colon is also surgically treated, and the left side is also surgically treated. When you treat the rectum, the treatment is a little bit different than the rest of the colon. So we'll talk about it later on. So now, if we diagnose the cancer, then by colonoscopy, we'll wait for the biopsy to confirm the diagnosis. Then we'll go ahead and do other investigation, which include the CT scan. CT scan is very important of the chest, abdomen, pelvis, and the CT scan will give us an idea if the tumor or the cancer has been spread. So after doing CAT scan, of course, the biopsy is very important to get the definitive diagnosis. Then, if we diagnose the patient with colon cancer, then we'll schedule him for surgery. Now the surgery is very advanced. We're using all advanced laparoscopic equipment, and we can be done through the laparoscope and can be done through the transanal approach, or it can be done open, of course. It depends on the case, but our preference, and scientifically and according to the data what we have, a laparoscopic approach is now the preference, and because it gives you better post-operative care for the patient. So when we do the laparoscope, what do we mean? We do the surgery through a keyhole surgery, where we can resect the whole colon or part of the colon through the keyhole surgery. Also, we can do resection of the entire colon through a single port, what we call the single port surgery. A single port surgery is a new modality we use, and we can resect the whole colon and the rectum at the same time through a single hole surgery. Now, if we have a rectal cancer, sometimes we have to do another treatment before we do the surgery. We call it radiation. So depending on the investigation when we do for the rectal cancer, we have to do sometimes extra step which called radiation. The radiation is to shrink the tumor. This we do it before the surgery, and this will help us for the patient as well for the surgery point of view, and it will help the patient to reduce the recurrence, and also it will help the patient to have better prognosis. Now, after the diagnosis and the treatment, after the surgical treatment, as I said, we do the surgical treatment through the laparoscope. It takes about 2 to 3 hours for the surgery, and the patients usually start normal life within days after the surgery and start eating within days after surgery. The pain is much less than the open technique because the incision is much smaller, and the patient usually return to his normal activity is much quicker than the open technique. And this is why we do most of the time laparoscopic technique, either through multi-keyhole surgery, or we do it through a single port, or we do it through a transanal, which is incisionless surgery. So after doing the surgery, according to the stage of the tumor, we'll decide what other treatment is needed for the patient. If the patient has the early stage, which is stage 1 or 2, most of the time you will not require any further treatment, and will be the surgical options will be enough, which is will be the surgical resection. But if the patient has the tumor is stage 3 and above, which is stage 3 or 4, at that, in this case, we will need to add adjuvant therapy, what we call the chemotherapy. The chemotherapy, depending on also the type of the tumor, the location of the tumor, the type of the cell inside the tumor. This is deciding what type of chemotherapy we can give. And the chemotherapy, usually we use it to add more value for the patient in a way that will give you better prognosis, and the patients have longer living life. So this is in brief the treatment of colon cancer and rectal cancer. The new modality now we use for rectal cancer, what we call the transanal approach, which is that incisionless surgery, where we can resect the tumor from the anal part, and we have special equipment for that. Also, there is a new advances regarding the surgical point of view. It's using the robotics. The robotics is also a new advances in surgical era, where we can do as well resection of the colon and the tumor through the robots. The robots will help us to do that with a special equipment. So the advantage of the robot that give you better view for the abdomen, because of the special camera that it has. Also, that you will have multiple arms where we can use multiple techniques to resect the tumor. So in reality, the treatment of the colon cancer, it's available here in Kuwait, and we have the highest advances technology to use to treat cancers. And the cancer usually actually increased in the past 20 to 30 years, and the treatment is available. Now, how to prevent? This is a good issue we have to talk about. How to prevent cancer? Because the cause of the cancer, exactly the cause of the cancer is not known yet, but the prevention is important. What we can do to help us to prevent it. The first thing we have to do is that to eat healthy, to avoid junk food and high saturated fat food. Second, we have to eat a lot of fibers and vegetables and fruits. This will help us to give us antioxidant and to help us for the movement of our bowels. Thirdly, is exercising. Exercising actually is very important for the health of the body and the health of the colon. So this is in brief about the colon cancer and how we treat it and what we have available in Kuwait. I have to reassure our viewer that the treatment is available and the investigation has been done is safe and can be done mostly in all hospitals in Kuwait. And the treatment now, with the advances we have, the surgical treatment is very advanced, and most people, they have their surgery and they go home within days after surgery. And thank you very much.